This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Menchu Makapagal, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
They consider shrimp as their favorite seafood. But not for John Russell, a college student.
Nung kumain po ako ng seafood, nung shrimp po, namantal yung katawan ko.
John Russell was not aware that eating seafood like shrimp could trigger his asthma.
Medyo malalaki po talaga yung mga pantal, and then sobrang makate siya. And then sumabay pa yung sobrang hirap ng paghinga. Kapag po nagkakaroon ako ng nahirapan akong huminga, yun po parang hindi ko po ako makahinga gamit yung nose ko, so kailangan bibig.
An allergy is a hypersensitivity disorder of the immune system. The immune system produces substances known as antibodies.
Not all pantal is allergy and not all allergy is pantal. Being an allergic person means na it's in your genes, na mamana. So usually you have a family history of either asthma or allergic rhinitis or pagpapantal or urticaria, and then that gene is passed on to the child, and then the manifestation may be different because when we say allergy, it's not just limited to the skin.
The most common allergies include allergic reactions to food and drugs. Among Filipinos, top food allergens are milk, eggs, and seafood. A patient suspected to have an allergy is advised to take a skin test.
Skin test is one way of finding out what exactly you should avoid. Avoidance is very important. So if it is a food allergen, we recommend strict avoidance for maybe a year until your immune system forgets, and then you can reintroduce.
What causes these types of allergies? How does one develop a certain allergy? Who are more prone to have allergies? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Jovilia Abong, allergologist and the president of the Philippine Society of Allergy, Asthma, and Immunology. And also with us is Dr. Linda Varona, allergologist and the immediate past president of the Philippine Society of Allergy, Asthma, and Immunology. Good evening, Doc.
Good evening.
Doctors.
Good evening.
Welcome to MedTalk. Thank you very much for allowing us to have this free consultation, if you will. For tonight, we're talking about allergies, of course. And I think that this is really important because a lot of people are walking around and not even knowing that they're allergic to certain things in the environment, right? So how does one develop an allergy?
Okay, how? When an allergy is usually an inherited disease, and when you meet that allergen around or in the environment, that's when you have the manifestation or the signs and symptoms of allergy.
Okay, so what exactly happens to the immune system, the body, when we encounter allergens or when we have an allergy?
At first, the body recognizes it as foreign, and then the body reacts, as she has said, producing antibodies. So the next time that person gets exposed to that allergen, let's say house dust mite or the shrimp or chicken or egg, that thing causes a very fulminant reaction, or the body releases histamine and other chemical mediators that causes the manifestations.
So basically the body kind of overreacts.
Yes, that's
to
right.
normal, to what other people would consider normal things.
Yes, that's
wow,
true.
very interesting. So in your years of practice, what are some of the types of allergies that you've encountered?
Well, food, this is type 1. There are different types of allergy, but the allergy we're talking about tonight is the instant reaction. Mostly it's food, then allergic rhinitis, asthma, or yung skin asthma or atopic dermatitis.
Okay, so when we say I know that there are three different, let's say, if you can categorize it. You have the allergy to food, maybe, and then you have the drugs, and also respiratory.
Yes, respiratory allergies. Yes.
So can you just give us like a quick differentiation of the three?
Okay, respiratory allergies would consist of allergies in the nose. That's what we call allergic rhinitis.
Okay.
We have allergy in the bronchioles or the airways. That would be the allergic bronchial asthma. And sometimes also you may have allergy in the mucosa of your eyes. We call that allergic conjunctivitis. So that's what consists your respiratory allergies. Now, we also have food allergy that may usually manifest in the skin, but it can also manifest as in the respiratory system. And in worst cases, you may have a systemic reaction that we call anaphylaxis. And also we have drug allergies that may also manifest the same as food allergy.
Okay, so let's take a quick look at the food allergies, because that was what we saw in the video earlier that we played before we came on. Why do you think that it's important for people to know what they're allergic to when it comes to food?
Well, it's important because the best treatment for allergy is avoidance. So if you're able to identify the food that causes the reaction, then you can prevent a potential severe allergic reaction.
And is it possible to find out if you're allergic to a certain type of food if you haven't been exposed to it yet? Like maybe a test or something? Or is it you have to be exposed to it talaga?
Usually patients come to us when they already have a suspicion or a manifestation of an allergic disease. We don't usually do routine diagnostic tests unless, of course, we suspect that that patient has an allergic reaction and we want to confirm that his suspicion is correct or not.
Now, you mentioned something called anaphylaxis. It sounds like such a scary word.
Yes.
So what exactly does it mean?
Yes, anaphylaxis is actually a systemic reaction, meaning we have a lot of allergic cells in the body. We have allergic cells in the nose, and then if they're triggered, then you have the local manifestation in the nose, what we call rhinitis. But if they all react at the same time, then that is a life-threatening, a potentially life-threatening reaction, because all the mast cells in the body will react.
Oh wow! Is this what they show like in the movies, yung anaphylactic shock?
Yes, that's it.
But normally you have only a few seconds or a few minutes before
the onset.
The onset, right? So if, for example, you're witnessing this as it happens, what are some first aid steps that you can take?
The best antidote, of course, would be epinephrine.
Okay.
That's really the antidote for anaphylaxis because it is a very rapid reaction and potentially fatal. But if you encounter one without any medications at hand, then you have to secure the airways of the patient, because if you have anaphylaxis, there's a potentially there's a potential obstruction of your airways. Your blood pressure may drop, so you have to ask the patient to lie down and raise his legs so that the return of the blood to the brain will be increased.
Does it have to be on a flat surface that's hard?
Flat surface like the sofa would do, but you have to elevate the legs.
Okay.
And then if there is already a circulatory collapse, then you have to do your resuscitation.
And call a doctor.
Yes.
For sure.
Yes.
Call a doctor for sure.
For
so
sure.
What about, you mentioned something about allergic rhinitis being one of the respiratory allergies that you were talking about earlier. How do you know that that is allergic rhinitis? What is it exactly?
Allergic rhinitis is actually the most common allergic manifestation. So it's the most common. And then you can tell it by recurrent, like on and off symptoms of sneezing, then runny nose, and If it's severe, you can have congestion, nasal stuffiness, then also nasal itch. So if these are the symptoms and it's always there, then most likely you will suspect an allergic rhinitis.
So this is something that goes on for a long period of
Yes.
time. This isn't something that maybe you experience for a week and then it goes away?
Yes.
Yeah.
And of course, aside from its recurrent and chronic nature, usually there is a family history of allergy, any type of allergy in the family.
Okay, so you've been mentioning a lot about a family history. So does that mean really allergies are parang genetic and it's handed down from parents talaga to their kids?
Around 85% of the time, it's an inherited disease. So if both parents have the same type of allergy, for example, if they both have allergic rhinitis, then the chances of their child having rhinitis also would be around 70.
70%?
So 70%,
That's
yes.
a pretty big number.
Yes, yes.
Actually, so is there a way that parents can actually minimize the risk of passing it on to their kids?
Well, allergy is actually interaction between the environment and the genes. So if the parents are aware that they have a strong allergic history, then they should already minimize too much exposure to the potential allergens, like maybe keeping pets or like carpets in the house, or like feeding the child with too much. Little exposure is at birth or at young age is now acceptable, like to make the immune system of the child recognize those things as normal and they will not treat it as foreign. But giving it too much might overwhelm the immune system and might have a reaction, develop a reaction.
Okay, so everything in moderation, I guess,
Yeah.
would be the key to that. So I think that we have a question via Twitter, Doc. So is it or is it not advisable to take medicines when having allergic rhinitis attacks? Doc.
Yes, actually, when you have an acute attack of allergic rhinitis, then you can take your medication.
Okay.
That's an indication for you to take your medication. And one of the first line medication for allergic rhinitis would be your antihistamines.
But when do you know that this is an acute attack?
Okay, for example, if you're allergic to house dust mite, yun yung sinasabi nilang allergic sila sa alikabok. When they come to a room or somebody is cleaning the house and then they suddenly have this sneezing and runny nose, itching in the nose, that's
a sign.
Yes, that's
already.
an allergic attack.
Okay,
yes.
so we're going to talk more about the signs and symptoms a little bit later on, and of course answer more questions. MedTalk will be right back.
Did you know that there is a cell phone allergy? Often referred to as cell phone allergy, this kind of allergy is actually called as nickel allergy. Prolonged exposure to a cell phone exposes a person to nickel, a metal that is often used in phone buttons, LCD screen frames, and headsets. Symptoms of this kind of allergy include presence of what allergologists call cell phone rashes, itchy red bumps, or painful blisters on the patient's jaw, cheek, and ears.
We are back on MedTalk and we are still discussing allergies. Now, when we left off earlier, we were talking about some of the symptoms when it came to allergic rhinitis. So let's talk on more broader terms this time around. Now, one of the more effective ways of figuring out if you have allergies to specific things is by getting a skin test. So can you walk us through that process? What is that process like and why is it important?
Okay. The type of allergy that we are talking about right now would be the inherited one, and one of the important antibodies would be what we call an allergic antibody, the IgE.
IgE.
And it is specific for a certain allergen. So when you are exposed to that allergen, then those specific IgEs are the ones that are that bind to it.
Okay.
So skin testing, in the skin, we place the extracts, drops of extracts on the skin. We prick it, and then the IgE, if you have the specific IgE there, it will bind to that allergen, and then it will now degranulate or activate the mast cell to produce all those allergic substances, and then it will create a wheal, a small wheal and a small redness on that area that will be very itchy, and we measure that to see whether you're positive or not.
So how long does the entire procedure take?
Usually the procedure lasts like less than an hour, but the waiting time is around 20 minutes. So you put little drops of the allergens, and then you scratch it. Then you wait for 15 to 20 minutes. If you develop a rash or like may pantal siya, then that could be a sign that that patient has antibodies against that allergen.
Okay, so you were talking about pantal or rash, and a lot of people, you know, when you see pantal on your skin, you immediately think, I must have come into contact with something, I'm allergic to something. So when can you say that you're allergic to something, or it's just an irritation on your skin? Is there a difference between the two?
Now, oftentimes, if it's just an acute outbreak of rashes, and then you have to review the history and correlate if there is something that triggered it. Because when you have rashes, it means, or yung pantal nga, no, or tagulabay, that means there is a release of histamine. So usually it can be an allergic reaction, but it's not all the time, because there are other things like physical factors, like too much heat, or certain medicines, or things that can trigger it right away, but it's not an allergic reaction that it goes through.
Okay, so what are some of the complications? Earlier we were talking about anaphylaxis, but there has to be some other things that aren't quite as drastic, if you will, and final. So what are some of the complications that can happen?
For allergic rhinitis, the long-term the complications would be asthma, sinusitis, or otitis media. You know, you have infections in the middle ear.
Is that the one where you feel like you lose your balance and there's like water inside?
Yes.
Okay.
Or there may be pus coming out if it's infected. You may have recurrent tonsillitis, or you may snore at night, and what we call obstructive apnea. You have prolonged periods of not breathing at all when you are sleeping. That's your apnea. And of course, your quality of life will be very affected by allergic rhinitis.
What exactly are the causes? Because we know with food, it's a specific food. But with allergic rhinitis, what are some of the triggers, if you will, or causes for it?
Well, when you do the skin testing, that's where you find out what are the causes. I think that's very important to find it out, because sometimes people just are in a denial stage. They don't want to implicate their cat or their dog or their carpet or the whatever is in the house, so they don't believe it. But if you do the skin test, you're able to identify it. Or if you really do not know, then how can you avoid what you do not know? So it's very important to do the skin test.
But doctor, there are a lot of people also who say that, you know, I'm allergic to a certain substance, so if I just continue to maybe eat a little bit of it, or after a period of time, I'm sure my allergy is going to disappear. Is that a fact, or is that dangerous?
If you're referring to food allergy, then that is dangerous, because it may lead to anaphylaxis. So even if the anaphylaxis is not a sure thing when you have food allergy, it is a life-threatening condition. So we try to avoid as much as possible. So if you identify your allergen, especially food allergen, then you have to strictly avoid that
Okay.
kind of food.
Now, with regards to the allergic rhinitis, so when you're exposed to these factors, it's okay if you still have your pet at home, or are you supposed to give
Well,
your pet a new home with someone else that you love?
I have patients who transfer their children rather than transferring the dogs or removing their carpets. No, but kidding aside, actually that's really the best treatment for allergy, and it's avoidance. So you really have to remove all those things, or you have to suffer the consequence. But there's also the other treatment, like it's called immunotherapy, wherein if you really cannot avoid the allergens, or you have severe symptoms, or you cannot tolerate the medicine, or cannot remove the medicine, then you can subject these patients to immunotherapy or allergy shots.
Oh, there are allergy shots that you
Yes.
can take para to immunize.
Yeah, that's a injection.
Okay, okay. Let's talk a little bit about, because we love to self-medicate.
Yes.
Let's face it, we really do love to self-medicate. And I've heard quite a few that if you have an allergic reaction and you don't have access to antihistamine or any medication, then just eat 2 spoonfuls of sugar or drink a can of soda. Is that
That's
a fact, or is that fiction?
That's a myth.
Really?
Yes, it is a myth.
Man, and I've been. So, what are some of the home remedies that actually do work?
Home remedy, I don't know of one, but the surest thing would be avoidance.
Avoidance.
Yes, allergen avoidance is always what we teach to our patients, and also in combination with medications and education.
Medications and
Yeah.
education.
And if-
so, yes?
And if a person has a known allergy, then it's best that he always carries with him or her the appropriate medicine, because you do not know when you will have the reaction or not.
Thank
or
you
if
very
there's an
much.
anaphylaxis, you need to have an injection with you.
At all times.
Yes.
At all times. Well, speaking of education, somebody on Twitter would like an education and is asking, my 3-year-old daughter has allergies. Will she outgrow it? Is there a chance?
Yes, there is, especially for respiratory allergies or milk allergies. Most of the time, in 70% of the time, milk allergies can be outgrown, especially from around 4 years old to around 16 or 17 years old, you can outgrow it at that time. Now, for respiratory allergies, there's a 30% chance that you will outgrow it when you reach your adolescence or your pubertal stage. When you have, in females, when you already have your, you know, when you're growing menstruation.
Okay.
And then for males would be when they're already starting to have low voice, when you know, when they're starting to have the growth bursts.
And is it also, if they have a chance of outgrowing it, as you grow older, is there also a chance of you developing
Yes.
new allergies?
Yes.
Wow.
Yeah, there's this thing called allergic march, and it's a phenomenon wherein the allergy target organ changes. Like it can start with the gastrointestinal tract, and then the skin, and then later on it fades out, and then you get the respiratory allergies.
So it kind of transfers from one place to the other.
It marches from one
Marches.
allergy to another.
And what do you do to treat that?
Okay, we cannot really treat it, meaning we cannot eliminate it, but we can delay. We can delay, because one of the first allergens that the infants are introduced would be food, especially milk. So that's what we call primary prevention. So if the family is has a history of allergies, then you can probably do primary prevention by giving them, of course, advocating breastfeeding. That would be best. And while the mother is breastfeeding, she should avoid the very allergenic food, like, of course, milk and milk
Eggs.
products.
So
eggs
exposure
and
to the
exposure,
high
yes,
risk,
yes.
high risk foods. We have another question on Facebook this time. I get rashes whenever I eat mangoes, but it's something that I can tolerate. I was told that I'll get immune to my allergy if I continue eating mangoes. Is this true? So she can tolerate the reaction.
Oh, actually, there's something in the mango. Maybe it's the yung dakta or lectite that causes the itchiness. So it might not be allergy at all. So that's a possibility.
Number 2 would be if you have allergic rhinitis and you are allergic to the pollens around, then it can cross-react with fruits. And so you will have also, when you eat fruits, fresh fruits and vegetables, you may get what we call oral allergy syndrome, where you have manifestations of itching and rashes around the mouth.
Okay, so those are definitely signs and symptoms that we need to be watching out for.
Yes.
Thank you. Thank you very much, Doc, for sharing your time and your expertise with us tonight.
Thank you for inviting us.
Definitely eye-opening. And of course, I'd like to thank Dr. Abong and Dr. Varona for joining us in our discussion tonight. We'll see you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on Solar News Channel. This is Medyo Makapagal. Good night.